Hey guys, okay, so we are going to start going over some of the chapters that we did not cover in our syllabus. So this is going to be going over chapter 7. Again, like always, I want you guys to make sure that you are reading the chapter fully and not just what I go over, because I'm only going to hit on the big parts of the chapter. Okay, chapter 7, Physical Agents to Promote Tissue Healing. Page 206. Introduction to Tissue Healing. Physical agents are often employed in the medical office to promote tissue healing for individuals who've experienced a disability as a result of injury, disease, or loss of a body part. Physical agents are used therapeutically to improve circulation, provide support, and promote the return of motion so that the individual can perform the activities of daily living. Physical agents frequently used in the medical office include heat and cold applied locally and ambulatory aids such as crutches, canes, and walkers. All right, for local application of heat and cold. The application of heat and cold is used therapeutically to treat conditions such as an infection and trauma. The medical assistant may be responsible for applying various forms of heat and cold at the medical office or for instructing patients in the proper procedure for applying heat or cold at home. The medical assistant should have a basic understanding of physiological effects of heat and cold on the body and of possible adverse reactions if they are not administered correctly. Please highlight the following. Heat and cold can be applied in moist or dry forms. Common applications of dry and moist heat and cold are as follows. Number 1, dry heat would be a heating pad or a chemical hot pack. Number 2, moist heat, which would be a hot soak or hot compress. 3, dry cold, which is an ice bag or a chemical cold pack. And number 4 is a moist cold or a cold compress. Please highlight number 3 and on number 4 for heat and cold are applied for short periods, typically 15 to 30 minutes. For factors affecting the application of heat and cold, before applying heat or cold, certain factors must be taken in consideration to prevent unfavorable reactions, such as tissue necrosis. The temperature may need to be adjusted based on the following conditions. Number 1, the age of the patient. Please highlight number 1. Young children and elderly patients tend to be more sensitive to the application of heat or cold. Number 2, location of the application. On number 2, highlight that broken skin, such as found with an open wound, is more sensitive to heat and cold and is more prone to tissue damage. For number 3, impaired circulation, please highlight diabetes mellitus. Number 4, impaired sensation. And number 5, individual tolerance to change in temperature. For heat, the locations of heat, the application of moderate heat to a localized area of the body for a short time, approximately 15 to 30 minutes. Please highlight the following. Produces dilation or an increase in diameter of the blood vessels in the area as the body tries to rid itself of excess heat. This results in an increased blood supply to the area and tissue metabolism increases. Also highlight that arrhythmia is reddening of the skin caused by dilation of superficial blood vessels in the skin. For the purpose of applying heat, heat functions in relieving pain, congestion, muscle spasms, and inflammation. Please highlight that conditions for which the local application of heat is often prescribed are low back pain, arthritis, menstrual cramping, and localized abscesses. Heat promotes muscle relaxation and is often used for the relief of pain caused by excessive contraction of muscle fibers. Please highlight that edema or swelling in the tissues can be reduced through the application of heat because the increased blood supply functions to increase the absorption of fluid from the tissues through the lymphatic system. On page 211, for the purpose of applying cold, please highlight that the application of moderate cold for a short time is used to prevent edema. On types of cold applications, ice bag, cold compress, and a cold chemical pack. For the chemical cold pack, please highlight where it says chemical cold packs should be stored at room temperature. On page 212, please become familiar with procedure 17.1 on applying a heat pad. Also highlight number 4 procedural step for the principal and number 6 procedural step. Please become familiar with procedure 7.2 and 7.3. Procedure 7.4, highlight number 5, principal step and principal. Procedure 7.5 and procedure 7.6. On page 218 for casts, please highlight the following. The cast keeps the fractured bones aligned until proper healing occurs. Also highlight that casts are applied by an orthopedist, also known as an orthopedic surgeon. On page 219, in the second paragraph, please highlight that a pressure area occurs when the cast presses or rubs against the patient's skin and prevents adequate circulation to the area. Also highlight that deep pressure ulcers often become infected by invading organisms and develop gangrene. On page 219 for the synthetic cast, highlight that a synthetic cast consists of knitted fabric tape made of fiberglass. For cast application, highlight that 4 to 6 weeks are usually required for the complete healing of a fracture. On number 1, inspect the skin. Highlight that a patient's skin should be inspected for redness, bruises, and open areas. On page 220, please highlight on number 2 for apply a stockinette. Highlight that the purpose of the stockinette is to provide patient comfort and to cover the rough edges at the ends of the cast. Number 3, apply the cast padding. Highlight that extra layers of padding are applied over bony prominences to prevent pressure areas. On number 4, prepare the synthetic tape. Highlight that the roll of synthetic tape is fully immersed in cool room temperature water. Also highlight that for 5 to 15 seconds. On page 221, number 5, apply the cast tape. Highlight that the synthetic tape is applied over the cast padding. And number 6, allow the cast to dry. Highlight that it usually dries within 30 minutes. For guidelines of cast care, please review each of the bullet points, but I want you to highlight number 2, number 3, number 6, and number 9. And then on symptoms to report, please highlight and review each of those bullet points. For cast removal, on page 223, I need you to highlight where it says the extremity also appears thinner and the muscles are flabby. For splints and braces, please highlight that a splint is a rigid, removable device used to support and immobilize a displaced or fractured part of the body. Down 2 more paragraphs, you need to also highlight that a brace is designed to support a part of the body and hold it in its correct position to allow for functioning of the body part while healing takes place. Also highlight that a short leg walker is often used instead of a cast to heal a stable fracture. For example, stress fractures of the lower leg. On page 224, ambulatory aids, highlight that the word ambulation means walking. Patients who are ambulatory are able to walk as opposed to being confined to a wheelchair or a bed. Highlight that the device used depends on factors such as type and severity of the disability, the amount of support required, and the patient's age and degree of muscular condition. For crutches, please become familiar with both the axillary and the forearm crutch. And then also highlight that one advantage of the forearm crutch is that the individual can release the hand grip, enabling use of the hand while the metal cuff holds the crutch in place. Individuals who are paraplegic or have cerebral palsy use the forearm crutch most often. For the axillary crutch measurement, highlight that incorrectly fitted crutches increase the patient's risk of developing back pain, nerve damage, and injuries to the axilla and palms of the hands. In the next paragraph, please highlight that this can injure the radial nerve in the brachial plexus, which eventually may lead to crutch palsy. For crutch guidelines, please highlight number 1, 3, 4, and 7. And for canes, highlight that a cane is a lightweight, easily movable device made up of wood or aluminum with a rubber tip and is used to help provide balance and support. Continue highlighting that canes are usually used by patients who have weakness on one side of the body, such as patients with hemiparesis, joint disabilities, or defects of the neuromuscular system. Down below, a couple to the next paragraph, highlight that a cane is held on the side of the body opposite the side that needs support. On page 227, please highlight on procedure 7.7, number 4 procedural step, number 2 procedural step on procedure 7.8 on the principle, and a 4-point gait on page 228. Highlight 3-point gait on page 229. And for this chapter, it is extremely important that you read over all of the case studies, all of the figures, and the procedural steps for this chapter, as well as don't forget to read over your medical terminology review.